Hello, everyone, and welcome to Arkansas Connections, the podcast bridging communities and statewide resources. Today, I'm joined by Crystal Sevier, who works for Gilead. Hey, Crystal, how are you?
Good. How are you? Thanks for having me.
I'm doing wonderful. I'm so excited to have you here to talk about Hep C. But before we do that, tell us a little bit about the work you do for Gilead.
So, I am a therapeutic specialist for Gilead Sciences in the Hepatitis C division. So, a lot of what I do is getting out into the community, encouraging patients in the community to get screened and treated for hepatitis C. And then the other side of that is working with the healthcare community, the doctors, prescribers, nurse practitioners, nurses, and getting them to screen and treat hepatitis C. So, we're trying to eliminate Hep C in Arkansas.
What do you find the most rewarding about your job?
Oh, don't make me cry. um,
Oh,
yeah, that's a. I mean, I just absolutely love what I do. I feel like I'm making a difference. I've been in pharmaceutical sales for about 15 years now, and I've sold a lot of great products. But working for Gilead, I mean, you really do see people's lives change, and getting cured from Hep C has been a huge motivator to these patients and their families. So it doesn't just impact that one patient; it's impacting their children, their parents, their siblings. You know, it's a disease of we're trying to slow the progression of this disease, the transmission of this. It's a disease of transmission. And to do that, you know, when you treat one patient, you're not just treating that patient, you're changing their life. I mean, it's a huge motivator for lifestyle changes. And that just brings me so much joy.
awesome. That's great. I love asking people what they like about their job because it lets you reflect on yourself and why you do the work you do. Like working for EAC, I loved getting to help tell stories of people who've overcome stigma or obstacles in their life. That's why I
Yes.
did not know that there are 2.4 million people in the US that have Hep C and they don't even know they have it. Like I thought that was a huge number. Why do you think so many people have Hep C and they don't even know it?
Well, again, Hep C being a disease of transmission, which means it's transmitted through blood, and it can be a teeny, teeny, tiny dot of blood. Some of those ways that the virus is transmitted is needles. So if you share a needle, it can be transmitted that way. Also, we have, you know, if we have a pregnant mother, it can be vertical transmission, is what we call that, when the baby also gets Hep C. It's not very common, but it can happen. Excuse me. Um, let's see, let's say you stop on the side of the road to help somebody who's been involved in a car accident. You know, a teeny tiny amount of blood can enter your bloodstream and you can get the virus that way. Tattoos, that's a really big one. Prison tattoos, or even at a tattoo parlor, they may change out the needle but they don't change out the ink. So that you know, something could be infected that way. Sharing toothbrushes or razors, again, it's a teeny tiny amount of blood. So which is why we want to encourage everyone to get screened for hepatitis C. With the since COVID, you know, in the last 4 years we saw a huge increase in opioid use, and with the increase of opioid use, we've seen a huge increase in injection drug use. So, where that is on the rise and the sharing of needles is also on the rise, we see that our hepatitis C numbers are also growing. So, it actually may even be more than 2.3, 2.4 at this point, and they don't even know it. So, we've got to get them screened.
I worked with this goes back to the tattoo parlor and I worked for a university and they had an underground tattoo set up in one of the dorms. And I just remember thinking, oh my gosh, that's so like not only Hep C, but there's other kinds of sexual or just diseases that transmission through blood that you can get. And I was just like, oh my gosh, like those students, they probably don't even realize it because I know I was not very informed about Hep C and like what puts you at risk for Hep C or that even Hep C is curable. I know that is something I learned recently, and I'm just like, oh my god, like how did I not know this? But how easy is it to treat and cure hepatitis C?
So easy. Hepatitis C is easier to cure. I mean, it's curable, so there's that. And even if a patient has Hep C for a second time or a third time, they get reinfected because they go back to, if it's, you know, sharing needles and they get reinfected, you can get cured again. So there is a cure out there. Treating hepatitis C is easier to treat than diabetes. So We have really great treatments. Yep, we've got great treatments out there. They range between 8 to 12 weeks, and it's just, you take a pill or a few, depending on what your treater prescribes, a day, and within 8 to 12 weeks, then you come back and you get your SVR, which is what a sustained viral load, and that's just checking to see if you still have the live virus in your system. And I mean, the cure rates out there are about anywhere from 98 to 100%. So we can expect patients to be cured, which is awesome. You can't say that for a lot of diseases out there. Yeah.
That's great. So if I go to one of the test sites like what EAC offers or other testings, and I find out like I come back positive for hepatitis C, what would be my next steps to do?
Yeah, so once you get your results back, and so if you're doing a screening out in the public, you'll get what is called a positive antibody. So just because you get a positive antibody does not necessarily mean you have a live hepatitis C virus. So let's say you had hepatitis C, you knew you had hep C 10 years ago, and you've got some risky behaviors again, so you get screened again and you have a positive antibody. You're always going to have a positive antibody if you've had hepatitis C in the past, but you could have another virus also. So you want to go to your provider, whether it's your primary care provider. If you don't have one, I'm sure EAC can refer you to someone, and where you can get your a confirmatory test. So it's just additional blood work just to confirm whether or not you have a live virus. And if you do, well, then your doctor can get you treated pretty easily.
And if you're looking for a doctor, I know the arkansasresourcehub.org lists a lot of different clinics that are in a lot of different locations. So you can just go on there, look, and try to find one that's closest to you. Is the treatment affordable?
Yes. So I have seen most patients won't pay more than $5 a month, but the majority of patients probably get it for free. So because there's a huge push from the World Health Organization and CDC, we're trying to eliminate hepatitis C throughout the world and especially in the United States. And to do so, insurance companies have to have favorable access to these treatments. So yes, because again, it's a disease of transmission. You cure one patient, you're slowing that disease transmission because one infected Hep C patient can infect 20 people in the first 3 years.
Oh, wow, that's
Yeah. So then those 20 go and infect another 20 each.
mhm,
So it can grow rapidly, which is why we've got to treat it. So there's a huge push for it to be treated, which means insurance companies are covering it and most patients won't pay more than $5 a month.
oh, that's awesome. That's awesome
Yes.
because I know affordability is sometimes might be a reason some people don't go get tested because they're just like, know what? I don't have symptoms. Nothing's happening. We'll just, if something's wrong, you'll show up and then I'll go. But is there a stage where it's too late to get cure
No,
or any damage
nope.
that could happen?
So your liver is pretty impressive. Your liver is one of the only organs in our body that can actually show improvement after treatment. So where you get fibrosis is scarring of the liver. As your hepatitis C progresses, I mean, you can have Hep C for 10 to 20 years and have a staging. It ranges anywhere from F0 to F4, F4 being the most severe. You can still treat an F4, and you may see some improvements where later on when you come back and you look at your and they look at your liver, it could be an F3 or an F2. So it's just everybody's different, but it does not matter the staging of your hepatitis. You can still get cured.
That's awesome. That's
Mm-hmm.
it's nice to know there's like sometimes a lot of these diseases or infections are really scary, but this is one of those ones that seems if you find out you have it, just don't panic. It's very treatable, curable, and just
Yes.
go to your doctor. Is there any stigma that you've come in contact when it comes to talking about Hep C? Like a lot of things that people get wrong.
Yeah, and I'd say from like the provider's perspective, it's changed so much over the years. I've only been a therapeutic specialist for 2 years at Gilead, but in about 7 years ago, I worked in a specialty pharmacy with the hepatitis C division at that time, where access was so much more difficult. Insurance companies weren't covering the treatment, or it would take 3 to 6 months before the patient could get their treatment. Or there was a fibrosis restriction. So, as we just talked about, the liver, being an F0 to an F4, whereas some insurance companies would only allow an F3 or an F4, which means you had to have Hep C for a really long time and be really, really sick, or on the sicker side, I would say, before they would even approve a treatment for you. All those days are gone. So the other one, sobriety restriction. I hear that a lot. Well, my provider told me that if I'm still using drugs, I can't get treated. That's not true. We actually encourage treatment even if patients are still using drugs, because there's a lot of data out there to support that the patient can still achieve a cure even if they're still whether it's injecting drugs or if they're hazardous alcohol drinking, you can still get cured. So the stigmas out there, I would say, from the patient's perspective, is that well, the doctors aren't going to treat me because I'm drinking or I'm using drugs, or whatever it may be. Those days are gone. Providers are going to treat. Like, we are encouraged to treat everyone regardless of their circumstances.
That's great to hear. It's nice to
Yeah.
know we're making progress. We're making progress with
Yes.
all these things. So, all right. Well, is there anything else you can think of that we should discuss? Like, are there symptoms? Well, I guess, you said you can live with it for a long time, but are there any symptoms that might make you go, oh, maybe I should go get tested?
Unfortunately, not really. Hepatitis C is so silent. You don't really experience symptoms of Hep C. You might have some fatigue, some tiredness. What we do see is that once patients start to get treated, they start to feel better within a few days of starting their treatment, but they didn't even know that they weren't feeling good because that had just become their normal. So they start to feel like they're a little bit more energized, but because their liver's starting to heal, and they had no idea that they were experiencing fatigue. So it's pretty silent. And then the treatments out there, I mean, they are so well tolerated. They don't have very many side effects. So it's just, I mean, it's so easy to cure. We just got to get those patients screened and get them treated.
Fatigue seems to be a big symptom in a lot of different illnesses.
Everything.
I'll look at symptoms and I will see fatigue. I'm just like, well, man,
Maybe I have
thought
that.
I was just,
Maybe.
well, thank you so much for coming on Arkansas Connections to talk about Hep C and the ways to get treatment and that it's totally
Yes.
curable. If you would like to get tested for Hep C, check out the clinics listed on the Arkansas Resource Hub website. All right, thank
Yes.
you and
Thank you
have
for
a
having me.
great day. Oh, no, thank you.